Today I am going to deal on a most important topic, so that is malaria. Okay, so about what is malaria? So what are the complications from malaria? How we are going to prevent? So that is malaria. Okay, here the malaria in the previous, so that is in the olden days, the malaria is considered as it is coming from the bad air. Here the mal means it is a bad area is nothing but it is the bad air. Because what people they thought the malaria is coming from so the bad air, but it is not right. But in the year, so that is 1897, the first time the Ronald Ross is a British medical officer. He studied very sincerely regarding to the malaria and how it comes, and he studied so the serious study on the malaria and find out so the causative agent for the malaria. So that is female anopheles mosquito, and he identified so that is malaria parasites in the so that is gut of the so that is anopheles mosquito. For that reason, he got Nobel Prize in the years 1902. Okay, the first identified so the causative agent for the malaria. Okay, so now come to what is malaria and what is different name for the malaria and how it spreads and what is the incubation period and how we're going to manage and prevent and eliminate okay so that is malaria from our country or world. What is the one by one detail here? The malaria, now comment the so what is the other name for the malaria? Here the malaria also we call as black water because the persons who are suffering from so malaria they shows signs like a so the signs and symptoms like a dark urine, so that is hematuria, blood in the urine. For that reason it is called as black water. So that is Mars fever. The Mars is so that is it is a Iceland in a United States. Okay, so almost all cases seen in so that is the Mars area, that is Iceland. For that reason it is considered as so that is Mars fever. Now come the incidence of so there is malaria. The earlier it was the very so there is severe so that is the infection from the so that is female the anopheles mosquito as well. It caused so many the complications and death occurred. But in 2000 so that is 24 and the 23 census. So in India so there is 2,27,564 people they are infected from the so the malarial parasite. Out of them, so the 83 people so they lost their life due to the malarial complications. But comparatively in the olden days, that dramatically very so that is decreased in the number of cases as well as complications also decreased due to the effective treatment strategy. Because the government of India adopted so that new schemes and new programs to control, prevent, and eliminate the so the malaria from our country. Okay. Here, coming to the so transmission, how it get transmits. Here, the malaria is not coming from a bad air, but it is usually transmitted by the infected anopheles mosquito. Usually in the group of so that is Plasmodium parasite. Here, the Plasmodium group of so the species so that is responsible for causing it, so that is malaria. Here, now come to the incubation period of so that is malaria. Here, in the Plasmodium family, they are having the different species. In that, the Plasmodium falciparum, Plasmodium vivax, or Plasmodium ovale, Plasmodium malaria, Plasmodium, so that is nivelsium. Here, now come to the incubation period. So the depending of the different species. Here, the normal usually so that is 7 to 14 days. It is the incubation period of our so that is malarial parasites. Among those, Plasmodium falciparum having a so 7 to 14 days. Plasmodium vivax as well as Plasmodium ovale is having a 12 to 18 days. That is the incubation period. The Plasmodium malaria is having a so 18 to so that is 40 days the incubation period. So Plasmodium so that is nivelsium. So it is having yes 9 to so the 12 days. It is the incubation period of so the different species of the malarial parasites are the Plasmodium group parasites. Here in a body, so first so malarial parasites so attack on the so it is liver, the kidney, as well as it causes the complications throughout the body. Now come to so clinical manifestations of so malarial parasites. For easy understanding, so the word the Umesh. Here U is nothing but so the uncontrolled fever and the chills. S is nothing but muscle pain. E is nothing but extreme sweating, excessive sweating. S is nothing but severe headache. H is nothing but hemoglobin level becomes reduced, also we call as anemia. Okay, so along with these symptoms, signs and symptoms, so some other symptoms also there. So the hepatomegaly, splenomegaly, so the hematuria. Okay, so all these are the clinical manifestations you are going to see in the persons who are suffering from so the malaria. Yeah, the first one is uncontrolled fever in the chills. The malaise or body pain, so the excess sweating, diaphoresis, so there is severe headache and the hemoglobin level becomes reduced. Also recorded as the anemia, splenomegaly, hepatomegaly, and the hematuria. All these are the different signs and symptoms we are going to see in case of malaria. Now come to the how we are going to diagnose so the malaria. We are using the different so that is laboratory techniques to identify the specific so causative agent for the malaria. So that is peripheral blood smear. So that is microscopic examination of the parasite under the microscope and the rapid diagnostic kit. Here in the rapid diagnostic kits, the malarial parasites produces antigen. In the diagnostic kit, we are going to identify the antigen produced by the malaria. So it is rapidly, very quickly. For that reason, it is considered as rapid diagnostic kits. Here now come to the management. Most important, the management option is that is oral chloroquine drugs. But here some of the parasites that develop resistant to the oral chloroquine drugs. We are using ACTS combinations, so that is anti-malarial drugs. Okay, so those who are developed the resistance against the oral chloroquines, amaploquines. Now come to here, what is the role of the government? Okay, preventing and eliminating so that is malaria from our that is country. The government of India has taken very serious actions to prevention of that is malaria in the year the 1953. So they started the National Malaria Control Program because earlier the severity is very severity was the too much. For that reason, the government of India planned just to control there is malaria. So that is for that reason the government of India launched the National Malaria Control Program in the year 1953, and again it's in the 1958. So they started the new program. So there is National Malaria Eradication Program. The control achieved, but the aim is to eradicate from our India. Okay, for that reason it started. So there is one more program. So there is National Malaria, so that is elimination program. But in the 2002-2003, the government of India started the one more program. So these two program initiated by so working under the so that is National Center Vector-Borne Disease Control Program. Okay, so this is the very important program. Is doing a nice activities to control or to prevent or to cure them. So that is malaria and eliminate the malaria. Okay, so by the 2030. Yeah. This malaria program, so all malarial programs, the government of India working under the TTT format strategy. So that is test, treat, and so it is test and the treat. Yes, and as well as to do the survey to eliminate so that is malaria from the country. Okay, so this is regarding to the clear cut information regarding to the government of India, what actions they have been taken. Now come to the complication of malaria. Here the malaria, it may cause severe complications like anemia, so that is hematuria, as well as organ failures, multi-system, so there is function of organ also so that happens. So it may causes cerebral malaria, also kidney failure, so the liver failure, and finally it may causes the severe seizures, it may causes coma and the death also. Okay, so this is regarding the different complications by the so there is malarial parasites or malaria.